Hello, 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 everybody. Welcome, welcome, welcome. Tonight, we are doing something a little different and very, very special. We're going to talk about liver disease and liver transplant. Our guest is Sue Green, BSN, MSW, MBA, author of Don't Call My Liver Fat, Liver Transplants 101, a book about MASLD /MASH, voted the top release on Amazon. She's a nurse, patient advocate, a clinical expert with high level counseling experience in healthcare, hospital administrator, liver disease and cirrhosis survivor, and a liver transplant recipient. So tonight we're going to talk about fatty liver disease, the fastest growing disease in America, and the one your doctor probably knows the very least about. It affects men and women of all ages and usually provides no symptoms until it is very serious. Sue's liver story starts in October of 2017 when she was diagnosed with liver disease. After visiting with many experts, physicians, she was told that she would need a liver transplant. She decided that she would look for a living liver donor. Her search was complicated by a car crash in July of 2020 by a hit and run driver, leaving her with a spiral fracture of the right arm and constant pain for over a year. She finally had her liver transplant January 4th, 2021 at the University of Pittsburgh Medical Center, the UPMC, with a donation from her living donor, Christina. Things became more complicated for Sue post-transplant when she was diagnosed with COVID-19 in January of 2021. She spent much of 2021 into 2022 as bedridden, and she tells me that this is long-term COVID. After a year after her transplant, she had what was supposed to be a routine biopsy, but fat was found in her new liver, and she was diagnosed with moderate recurrent, I'm going to try and pronounce this right, stenohepatitis with 40% stenosis. Somehow she managed to avoid rejection. Currently, she also suffers from macular degeneration. Sue has not allowed any of this to keep her down, and she now acts as an advocate for us through the sale of her very helpful book. And let me show you that book while I'm thinking about it. There. And just so you know, I do have a copy, Uncle Jim's messy copy, and I did read the book. So that's our friend Sue. Please give a warm welcome to a genuine organ transplant hero. Ms. Sue Green is with us tonight. Sue, how are you?
I'm good. Thank you, Jim, and thank you for having me.
Oh, I'm glad you're here. This is going to be a great talk. I'm looking forward to it.
Me too.
Did I state everything correctly in the introduction?
You did. It's steatosis is how it's pronounced, but
Okay.
they've changed the name and it's confusing, but we'll talk about that in a minute.
Yes, ma'am. Um, please tell us a little bit about your family life. Are you married? Do you have children, grandchildren?
I do. I have been divorced for almost 20 years, I guess, and I have two daughters who both live on the West Coast. They're in their 30s and they're very amazing women and wonderful daughters. And one of them has two children, a 5-year-old girl and a 2-year-old boy. And so those are my grandchildren. They're both very busy. They both have very demanding jobs, and but they're wonderful people, and I'm blessed to have them.
Wonderful. Wonderful. I understand that one of your daughters is a lawyer.
She is the one that lives in San Francisco. She works for a large firm there, and her
Okay.
her niche is financial law.
Okay. Please tell us a little bit about where you grew up, your education, and your employment experiences.
I grew up in Wilmington, Delaware, um, and I ended up going to University of Delaware and getting the bachelor's in nursing. And then I moved to Houston, and that's where I continued my education and my work, and lived there for 30 years.
Okay. I know you've had quite a bit of employment experience. Can you tell us a little bit about that?
Sure. So I started out as a nurse and worked clinically in a variety of different areas, a lot in psychiatry though. And I ended up getting an MSW and going into private practice as a psychotherapist for a while. But I kept getting called to do consulting jobs with hospitals to help them operate, improve their operations. That's when I went back and got the MBA. And I found that I really loved working with hospitals and trying to make them better, both for the patients, but also for the employees. And I really enjoyed that and did that for a long time. And I kind of went back and forth between consulting, and then I'd be hired by the person that had hired me as a consultant, to go into a permanent, well, it was never totally permanent, but I always told them that going in, that I usually would go for 3 to 5 years into a permanent position, CEO or deputy director or some top level position and that was really a wonderful thing to go back and forth between those two, because you get to do different things in those two different jobs and see the organization from two different perspectives. And so I did that for a long time, and it was really a good career. Um, I ended up in Atlanta, Georgia, at the public hospital there, and that was really a fun experience. It was a very challenging um, position. The hospital was about ready to go bankrupt, and if it had closed, it would have been a real tragedy for the city. It was a training ground for Emory and Morehouse medical students and a lot of other healthcare related students. But also the city really needed that hospital. So we turned it around pretty quickly, and I really loved that job and had a great time.
Wow. Talk to us a little bit about what a normal liver does and why a healthy liver is important to us.
Well, the liver is a very complicated organ, and we don't totally understand how it does what it does. So if you go into liver failure, there is no way that anyone can replicate what the liver does, because we don't totally understand it yet. But what the liver does is everything that you eat or drink or absorb through your skin or even breathe goes into your bloodstream and through your liver. And your liver decides what is a toxin and what needs to be passed through the body to nourish the body. It makes protein. It also has a big effect on your ability for your blood to clot. It does about 500 different things, the liver, and it's absolutely essential for our health. But we don't totally understand how it does what it does. So if you get in trouble with your liver, it's a big problem. Liver failure is not fun to go through. And, as you're deteriorating, it's very difficult. And oftentimes for people, the only answer is a transplant.
Okay. Sue and I were talking before the broadcast, and for my kidney friends out there, we both agree that many of us that have kidney problems also have liver problems. So there's a relationship between the two. So we just wanted you to know that. Let's talk about your liver experiences. I understand that you were diagnosed with liver disease in October of 2017. Please tell us what symptoms led to your diagnosis and what type of liver disease do you have?
Okay, my symptoms, I really didn't have any, and that's very common. Your liver keeps on, doing its job until it just is ready to go into failure. So many people do not have symptoms. The only symptom I had is I was enormously tired. In fact, I had driven across the country by myself on the trip of my lifetime. I mean, I had wanted to do this my whole life, and I went all over the place. And I ended up in California, and I was so tired, I couldn't drive myself back. I luckily have a brother that lives in California, and I called him up and asked him to drive me home, and he did. When I got back to the East Coast, I called my primary care physician and set up an appointment, and she did a thorough exam. The only abnormal lab value that I had was low platelets. So I had two symptoms: fatigue, which I didn't even, until I had to have him drive me home, I didn't categorize it as abnormal fatigue, and the low platelets. And I had been referred, she referred me to a specialist. I had been referred by her 3 years before that because I had low platelets 3 years before. I'd been examined by a doctor there, and he let me go with no findings. So I went back to this same practice, but a different doctor, and he knew immediately what was wrong with me. He confirmed it with imaging. I had liver cancer. I had cirrhosis of the liver, and they told me I had to have a transplant or I was going to die. So it was completely out of the blue and was a big shock. It's not something I ever considered that might happen to me, but it happens to more and more people these days. When I had my transplant, 1 in 4 Americans had this disease. It's called steatotic liver disease. And now it's gone up so much that 1 in 3 Americans have it. It's soon to overtake alcoholism as the leading cause of cirrhosis. And that's part of what shocked me when they gave me my diagnosis. I don't even drink at this point, and so I never would have guessed that that was what was wrong with me. But there are several pathways to get to cirrhosis in your liver, and one of them is alcohol, excessive use of alcohol, and the other one has to do with our diet. Do you want me to go on about what causes it?
Sure.
So sometime in the recent past, our diets really changed a lot. It was when they discovered high fructose corn syrup. And also around that time, they started using a lot of artificial sugars. And what happened from that is that people started to be ingesting large amounts of sugar. And it's the excessive sugar that destroys your liver. So for me, I drank diet soda every day, and that's pretty much all I drank. So I was having artificial sugar every day, all day. And after I had my transplant, there have been 2 studies that I know of that have linked this disease with diet sodas. But the thing about high fructose corn syrup and artificial sugars is that they are highly concentrated sugar. And also, high fructose corn syrup doesn't satiate you, it doesn't make you feel full. So you can ingest large amounts of it. And if you start looking at labels of food in the grocery store, everything has sugar in it. A lot of it is high fructose corn syrup. So we get just, large amounts of this in our diet without even realizing it. And it's just too much for the sugar, for the liver to handle. So
Okay.
what happens is, and this happens with alcohol and it happens with sugar. It turns into lipids or fat in your bloodstream. And the fat attacks your liver and wounds it and scars it. And that's what cirrhosis is, the scarring of the liver. And as it gets scarred, it can't work anymore the way it's meant to. So the more of your liver that gets scarred, the less it's working for you. And that's when you really start to get symptoms and go into liver failure. The usual symptoms of this disease are things like jaundice, you turn yellow. A lot of people get ascites, which means, their abdomen swells way up. They almost look pregnant. It's bigger than that even, and they have to go in and drain it out. You get esophageal varices, which the blood in your body changes direction because it can't do what it used to do with the liver, and it goes in inside your esophagus and it creates like little balloons in your esophagus which stretch, and those are what are called varices. And when you get those little balloons, they can break open and you start bleeding internally. And often you also will vomit it up, but it's a medical emergency. You can bleed to death from esophageal varices. So it's a very scary thing to have. And then the other thing that happens is when your liver isn't working is you get ammonia in your bloodstream, and that affects your brain. And it's very strange what happens. You slow way down. But the weird thing is, it's like you can't even realize that you're being slow. Other people will give you feedback that you're slow. Or I would get on the telephone with an automated system, and when I didn't respond quickly enough, it would hang up on me. And that's the only way that I knew that I wasn't functioning at full speed. But you also get confused, and it's a very scary process. Liver
Wow.
failure is not fun to go through.
Wow.
But all that stuff didn't happen to me till later. When I was diagnosed, I had just those 2 symptoms. But then I had to wait 3 years for a transplant. So,
Right. Right. This type of liver disease, is it possible that it can transfer or affect your transplanted liver?
yes, when I had my liver biopsy at 1 year post transplant, they found that I had essentially fatty liver disease again. So I have it again. My body, for whatever reason, some of it's genetic, but it's certainly not my diet. I changed my diet completely. Um, I think for the first year after my transplant, all I ate was oranges and tuna fish. I was so scared. But, you know, my liver is not functioning totally well now. It's my new liver. And that happens to a certain percentage of people that have liver transplants. Some people go back to eating the way they did or drinking the way they did, and that definitely can cause problems. But for some people, even if they do what they're supposed to do, they still get steatotic liver disease again, which is scary.
Okay. Wow. Wow, we're learning an awful lot tonight. I understand that you were in a car crash in July of 2020, and this complicated your search for a living donor. Can you tell us a little bit about what happened?
Well, I was driving, and I think I was driving very slowly because I was slowed down by then. And I probably shouldn't have been driving, but I was. But I was going to turn left, and someone got tired of waiting behind me and came around me into the oncoming lane and hit me and then drove off. It was a hit and run. And I put my arm out on the dashboard to stabilize myself, and it wasn't like a terrible accident. I mean, it was, but it just shattered my arm. I had a spiral fracture, um, and I had to have surgery. They put a rod in my arm, and they also had to fix my rotator cuff. And if you ever had rotator cuff problems, it is so painful. And I had pain in that arm for over a year. It did not affect, I mean, it affected my ability to focus on. By that point, I had decided I wanted a living donor. People who have living donor liver transplants do better, but probably that's mostly because they aren't as sick as the people that rise to the top of the deceased donor list. But they told me I would never rise to the top, or I wouldn't until I was, almost dead, which happens to a lot of people, unfortunately. They're very, very ill when they finally reach the top of the waiting list. So I decided I needed a living donor, and that's how I ended up at UPMC, because they have the largest living donor liver transplant program in the country. And they have outreach for it, and I learned about it online. And so I wrote a letter asking people to consider donating their liver, part of their liver, to me. And I sent it out to some family members, and I put it on Facebook, and some of my friends reposted it. And Christina, who responded and said, yes, I will donate part of my liver to you, is my half sister. But I hadn't seen her for 30 years. The last time I had seen her was at my father's funeral, 30 years before that. My parents divorced when I was young, and he remarried and had 2 children, and Christina is his first child in that family. So she called me up. First, she called my sister and said, is this Sue posting this? And my sister said, yeah, unfortunately, yes. So she called me and she said, you need a liver. How could I not donate? Which is just, it's amazing to me how some people, that's their first response. It's just such a generous response, you know? And I had several other people that offered initially, but for different reasons, they couldn't do it or whatever. And so it came down to Christina, and I said, let's go to UPMC. I think that's where we need to go. And she lives in Florida, so it was it didn't matter really. She had to get in a plane wherever she was going to go. But it was a trip for her, and the living donor has to go through the same hoops that the recipient does to get approved. I think she was at UPMC for 2 full days of testing, and it turned out that she was a good match for me, and they approved her, and it was, it was a miracle. It was just really amazing.
Okay. I want to finish up a little bit on the car crash thing.
Okay.
What were your symptoms after the crash? How did you feel? What was going on?
Oh, I was in terrible, terrible pain. I was very worried about being on the table for my transplant, which is for the recipient is up to a 12-hour surgery. They gave me OxyContin for the pain, and I took it even less than it was ordered. I never refilled that prescription, and I still, when I wanted to go off of it, I went through withdrawal. It's you really have to be careful with OxyContin.
Wow.
Uh, it's just so addictive. Um, and I just decided at one point that, I worried about it the whole time because I knew about OxyContin. Most people that work in healthcare do know about it. And I was worried about it, so I quit taking it before it ran out. And that was really hard because it's so painful. And it was my rotator cuff that was painful. Um, but, I decided I can't take this forever and I need to get off of it. So I did. But I went through a really rough week from that medicine.
Wow.
Yeah.
I want to ask you a little bit more about your liver transplant. But before I do, I want to remind our audience that you're going to be seeing links that pass through on the banners that are going on now during the broadcast. I know that those go by kind of quick. So what I do, as you know, if you follow your Uncle Jim, I post the broadcast to my Facebook page, and I pin that broadcast to the top of my Facebook page. And in the comments, I put all my research. So any of the links that you see that go by, if you're interested and they go by too quickly, you can get those links anytime you wish in the comments to the broadcast that's pinned to the top of my Facebook page, including where to buy Sue's book, which we're going to talk about in a little bit. Please tell us about your liver transplant on January 4th, 2021 at the UPMC. What was the state of your health immediately prior to the transplant?
It was pretty bad. I went from that point of just being tired to I was having a very hard time functioning. I never got jaundiced and I never got ascites, but I felt really, really bad. I couldn't function. I couldn't think. It was terrible. But I went up to Pittsburgh a month ahead of my transplant and I rented an apartment because if I had gotten COVID in that period of time, they wouldn't have done my transplant. So I isolated for a month up there. And then my sister came up, stayed with me the night before. And I actually fell in the bathroom the morning of my transplant. Luckily, I didn't get hurt, and she was able to get me to the hospital. I wouldn't have gotten through this without my sister. many
Okay,
different.
what's your sister's name so we give her credit? First name.
Ginny Green, Virginia. And
All right.
she lives nearby me now. So I get to see her a lot now.
She's still kind of looking after you then.
Yeah, she does. She and my brother, they both live here nearby.
Okay, and your brother's name, first name?
His name is Charles, but he goes by Chick Green.
Okay. How did you happen to get scheduled for a transplant since you had a living donor? My guess is you didn't get like the call, right? You had a living donor, so they scheduled. Can you tell us a little bit about that?
Well, I had registered at 2 hospitals and I was on 2 lists. And that other hospital called me the day before my scheduled UPMC transplant and said that they had a liver for me, which I turned down because the liver from Christina was a better fit for me. But I thought that was ironic that they called the day before. But I was already up in Pittsburgh anyway. And so, yeah, they schedule it ahead of time when it's a living donor. After the donor goes through all the testing and everything's approved, then they put you on their schedule. So, we knew, I don't know how far in advance, maybe a month, maybe 2, that we were going to do it in January.
Okay. Tell us what it was like the day of your transplant. What happened?
Well, it was like any other surgery, really. We both went in and were prepped, and um, I was pretty out of it by then. So, and I wasn't worried really. Um, I was just having trouble being mobile and thinking very well. I was real sick by then.
Uh,
So, they prepped us for surgery. They do it in 2 different operating rooms at the same time. They take 60% of her liver out of her. They take my diseased liver completely out, put the 60% inside of me, and attach it all back up. It's a very complicated, difficult surgery because there's so many blood vessels that they have to keep intact and but separate at the same time and then put back together. Um, so she was in surgery maybe 5 hours. I was in surgery for, I think, about 10. Then when you come out, they put you in the ICU first. And but they transferred me out of there pretty quickly. I really was doing well with the transplant. I had had abdominal surgery 3 other times in my life, so I knew what to expect. I wasn't in very much pain because I'd had hardly any nerve endings left in my abdomen. And they managed my pain really well. So I was up and walking really quickly and recovered very well and got sent home early. In fact, I had to have my sister come back up to Pittsburgh because I had set up 3 other people to be my caretaker after the surgery, but I was discharged too early. And so my sister came back up, and UPMC has a great family house where you can stay. And it's like a hotel, but it's a little cheaper than a hotel. So we went back there, and then we moved to an apartment that I had rented. After you have a liver transplant, you have to go back to the clinic like every 2 or 3 days. So I had rented an apartment so myself and my caretaker could stay nearby to the hospital. And we went there, and then one of my daughters came up to stay with me, and then the second daughter was scheduled to come after a week, and she did that. And I had sort of gone downhill. I felt like I just breezed through the transplant. It really was not that difficult, but I started to not be able to function. I couldn't inject, I had to inject my medicine into my abdomen, and I couldn't do it anymore. And then my daughter was trying to take me with her to the pharmacy to get some medicine, and I collapsed on the floor. I don't remember any of this, but I just fainted, I guess. I don't know. She put me back in bed and called UPMC, and they said, call an ambulance. Meanwhile, my poor daughter, I'm telling her, no, I don't want to go to the hospital. I don't want to go in the ambulance. I don't remember this, but she told me that's what I did. And but they came and they took me back to the hospital, and they tested me, and I had COVID. So they admitted me, and I was in bad shape from the COVID. I was hallucinating. I couldn't walk. I could barely talk. I wasn't making sense. And it was kind of an unusual COVID episode. I could breathe. I had to have a nasal cannula because I couldn't keep my oxygen saturation up on my own. But I didn't have trouble breathing. It was all neurological. And I stayed in that place for another month before they would discharge me. I had to get 2 negative COVID tests before they would discharge me, and I would have a negative one and then I'd have a positive one. Went back and forth like that, but I was very happy when I got discharged. And I went for one final checkup at the clinic, the transplant clinic, and then I went back to where I live now, which is about a 6-hour drive from Pittsburgh. And
Wow.
it's the COVID that I think disabled me so much. It's hard for me to separate out. Is it the COVID? Is it the transplant? Is it the immunosuppressants? It's probably all three, but I was not in good shape for over a year after that.
Wow.
Yeah, I would get out of bed to feed myself, take a shower. That's all I could do. I could not do anything else. Long COVID, the hallmark of that for most people is extreme fatigue. And when you do too much, you collapse. It's called post-exertional malaise. But if I would do too much one day, I would just be in bed for 3 days after that. And you're not supposed to do that to yourself if you have long COVID. It is actually harmful to you to exert yourself to that point. But at the time, I thought, it was just normal for me. I need to get moving as fast as I can, you know? So, but I couldn't. I couldn't do it. And so I would go through that, try to do as much as I could, and then I'd collapse for days. And it was a very difficult year and a half. And then I started to get better. I still have the extreme fatigue. I have to be really careful and pace myself and, not do too much in a day. Otherwise, it will happen again. And it's no fun at all. It's really, it's disheartening and it doesn't feel good.
Wow.
But I think my liver is okay. Most of the time, I've had normal liver chemistries. I did go through a rejection episode once, and it was during that year that I was bedridden, and they quadrupled my immunosuppressants, which just made me crazy. I mean, the side effects were unbearable, but that's what they do. And it got back to normal after some time. And then they're not sure what's going on right now. It could be rejection, but I think it's because there was a mix up with my immunosuppressants, and the doctor that I was seeing took me off of one of them that has to be taken every 12 hours because it has such a short half-life. And so I was only taking one a day, and that made my liver studies elevate. But
Okay, when
I'm
go
hoping
ahead, Sue. I'm sorry.
I'm hoping it's back to normal now.
All right. When you're talking about immunosuppressant medication, what kind of immunosuppressant medication do you take?
I take Celcept and everolimus. So I
Okay.
take 4 pills a day.
All right. And my notes are telling me that you were basically bedridden after this much of 2021 and through parts of 2022. Is that a fair statement?
Yeah, that's correct.
Okay. I read in your book that you had what was supposed to be a routine biopsy. Apparently, a year after liver transplant, it's routine for a patient to go through a biopsy. Can you tell us why do they do a biopsy a year after transplant?
Well, it can tell them more closely what's going on in your liver. So at that point in time, I was having normal blood work. But when they went in and did the biopsy, they found out that I have fatty liver disease again. And they couldn't tell that without the liver biopsy. But it's an invasive procedure, so they don't take it lightly. So they don't do it a lot, that's what I mean. But their protocol was to do it at 1 year.
Okay. From your point of view, what was the procedure like?
I truly hated that procedure. By that point, I was up to here with the medical system and, being poked and prodded. And it's like any other imaging procedure that you go through. You're in a hospital gown, you're cold, you're scared, you're, at the mercy of the technicians. And they give you a local anesthetic on your abdomen. And, I think that locals hurt.
Yeah.
So I thought that hurt. But then they come in, and this needle for the biopsy is huge. I mean, it was huge. It was scary. And I did not feel it when it went through my skin, but I felt it when it popped into my liver.
All this sounds familiar.
Have you had one?
No, but I've had kidney friends that did, and it's the way that they talk about it too. And so our audience understands that that needle's about a foot long,
Yeah. And it's thick.
right?
So it's looking back on it, it's not a horrible procedure. Everybody in your audience and you and I both have been through worse. But I think I had just had it. And to me, it was uncomfortable and scary. And then when I got my results, it was even more scary. Um, and it was the resident that called me with the results, and she just read it off the paper. So I didn't understand what she was talking about. And she said, "So you need to be careful." And I'm like, "Careful? What does that mean? What do I need to be careful about?" Anyway, so my usual MO is to go research everything to death until I understand it all. But I couldn't even figure all that out. Um, so I made an appointment with a gastroenterologist and went to see her, and she clarified it for me. And she said, "You have fatty liver disease again, but it's not the extreme disease that I had before." So maybe I should talk about the names of this disease.
Okay, we can do that. Um, okay, yeah, let's do that then.
So historically, it's been called fatty liver disease or non-alcoholic fatty liver disease, and it's called NAFLD as an acronym. And that just means that you're in the beginning, probably stages of the liver being attacked by the lipids in your body. When it progresses to a more advanced stage and the wounding is worse, then it's called NASH, non-alcoholic steatohepatitis. And if it gets really bad, then you have cirrhosis. But to confuse everybody even more, they've changed the name of this disease. They wanted to take away the NA, the non-alcoholic, because it's never a good idea to name something after what it's not. And if you're having this problem because of alcohol, there's another name for it. But they also wanted to take away the fatty liver name because they felt like there was stigma attached to that. And I think there is. And that's why I named my book "Don't Call My Liver Fat," because it's just, it's not because you ate too much, but that's what it sounds like. So they've changed the name to MASLD, which stands for Metabolic Dysfunction Associated Steatotic Disease. And the worst case after that is MASH, Metabolic Dysfunction Associated Steatohepatitis.
okay,
It's all the same thing at different degrees of severity. But in the end, you get cirrhosis and often you get cancer in your liver.
okay. And I just want to point out to people again, we had that information streaming by while you were talking. If the people in the audience want to know more about the disease that Sue has and what they're calling it these days and the different stages, that's all in the comments to this broadcast. And there are links. There are several links to articles, scientific articles, to explain all that. Because your Uncle Jim had to look all that stuff up too after I read her book. So I understand what she's saying when she's talking about uh, researching things and trying to learn more about what's happening with her. Can you tell
It's
us?
very confusing.
Yes. Can you tell us how did you manage to avoid rejection?
You know, I've been thinking about this, Jim. I think that people with kidney transplants are more susceptible to rejection than liver transplants. I tried to look that up and I did see several places that said that. But I know that it seems to me, just from my interactions with people like you who are in the transplant world, that people who have kidney transplants are more frightened about rejection. Maybe it's just because I didn't know any better. I don't know. But um, I did find one place that said that it happens more often with kidneys. But now that I know about rejection, I should have been afraid of it. But I didn't think much about it until it happened to me. And then it scared me a lot.
Wow.
And it was not pleasant to be put on quadruple the dosage of my immunosuppressants. Um, it felt like it was scary. It was very threatening, and it felt like I was going backwards. Um, so I don't know. It'd be interesting if anybody out there listening knows more about it than I do. But my sense is that it happens more often in kidney transplants.
Okay.
But it's always a risk for everyone.
I understand that you also suffer from macular degeneration. Can
Yeah.
you tell us a little bit about that and what's going on?
Well, it's another disease that they don't know what causes it, and there's not much they can do for it. Um, it's a disease of your eye, and worst case scenario, you go blind. Um, it can be what's called either wet or dry, and you can get injections into your eyeball. Uh, if it's really bad, they will start doing those injections. There is a certain combination of vitamins that they researched, and it seems to hold it off for longer. But it's a progressive disease of your eye, and the endpoint can be blindness. And
Wow.
when I found out I had that, I was sort of like, well, of course. um, I think some people would have thought, why me? But I didn't think that. I mean, I thought, why not me? And after the whole transplant thing, it sort of seems smaller, although the end point can be bad. Uh, but it's just another thing that they really don't know what causes it.
Are you diabetic?
I am diabetic, and I'm glad you brought that up because 1 in 3 people gets this kind of liver disease that we're talking about in America. Often they don't know they have it because they don't have any symptoms. But 1 out of every 3 people has it. If you're diabetic, that shoots up to over 70% of diabetics get it.
Wow.
And I'm happy to say that I've started to see that people are now recommending that they test diabetics for this disease, because there are ways to test for it. But, you know, if it's that high of a rate, they should be testing every diabetic. And any diabetic that is listening to this, I would really encourage you to go to your doctor and say, test me for liver disease. Because it is
Wow.
possible to do.
Okay. Do you take insulin too?
No, I did before the transplant. Um, and it's interesting because I tried to get my endocrinologist to take me off of insulin, because if you have a metabolic disorder, insulin is not always a good thing to take. And I'm not a doctor, so don't listen to that. But I had just read a lot and decided that maybe I should try something else besides insulin. Well, after I had my transplant, I went back up to Pittsburgh and saw a gastroenterologist there who knew even more than my transplant doctor did about this disease. And he took me off of insulin, put me on Ozempic, and that's all I take now for my diabetes is Ozempic, and it works really well for me. Keeps my blood
Great.
sugar low.
Are you losing weight too?
Well, when I had COVID and I was in the hospital for a month, I came out of there. I had lost 45 pounds.
Oof.
Yeah, it was a lot. And I've just not gained it back.
Okay. Let's talk about the book. I'm going to put the overlay up about the book while we're talking. Please tell us about your book. What is the book about, and why did you decide to write it?
Well, during that year and a half that I was essentially bedridden, I needed to do something to keep myself busy. And so I started researching, trying to understand what had happened to me. And so the book does explain steatotic liver disease, why people get it, where it comes from. And there are some interesting things in there because there is some evidence that things like air pollution and chemicals that we're exposed to can also cause this. So I put all that information together. So I explained what the liver does, why we need it, and what can happen. There's just so many different pathways to liver disease, but in addition to what I've just talked about. But I wanted people, I had been so surprised by my diagnosis, and I wanted people to avoid a transplant. Transplants are a miracle, but they are not fun. And, you know, you live the rest of your life on immunosuppressants. So if people can avoid it at all, if it's at all possible, then I want to help them be able to do that. At the time that I wrote the book or began the book, there was pretty strong agreement that most physicians didn't know anything about this disease. So most primary care physicians really weren't trained in liver disease, didn't know how to recognize it. Clearly that was the case with me. And I just wanted to help people avoid all that. So it also tells you what kind of tests you can ask for to make sure that you do or do not have it. And I try to explain the naming in the book so you can talk to your physician about it. And then there's a section also where, and I talk a lot about my personal experience and what I went through. And I think I talk very openly about all the difficulties. But the last part of the book is what to do if you're diagnosed, because the really amazing thing is when people get diagnosed with this disease, their doctors don't tell them what to do. It's only been recently that a medicine has been approved by the FDA, and it's only for, I can't take it, it's not approved for people that have been transplanted. It's only approved for a certain stage of the liver disease, and it's the only one for now, and it just became available. It was not available when I was sick. But for some reason, when people get diagnosed, they really are not given direction about what to do, mostly because there isn't a medicine. You know, doctors are not typically are not real well versed in helping people change their lifestyle, helping people do the lifestyle changes that are going to make them healthy again. And so I don't know if they don't know about it or they just don't go there because they don't feel like they're experts about that. So, I moderate on a online support group for NASH, and time after time, people say, "I was just told I have fatty liver disease. What do I do?" And they don't know. It's amazing. So I was hoping that last part of the book would help them also. My real goal here in writing the book was to try to help people avoid what I had to go through.
Okay. Um, I understand that the book was voted a top release on Amazon. Please tell us a little bit about that.
Well, Amazon has categories, and mine shows up in several different ones, but I think the main one is metabolism and endocrinology or something like that. Anyway, they keep track of how many books are sold, and if you sell the highest number, you're the top new release. And so the book was actually named twice as top new release.
Oh, wow.
Yeah, so that was nice.
Okay. And I want to point out to people, if you're interested in buying Sue's book, the link to Amazon and where you can find her book is scrolling across your screen currently. And again, if it's going by too fast or if it's too small, whatever, you can go to my personal page. The broadcast is pinned to the top of my personal page. And in the comments is all my research, and that includes this. So if you're looking for the link that you can go purchase the book, you can find it there. And of course, you can write me, you can write Sue, you can write her friend Jean, and if you need information about the book, I'm sure that they would be more than happy to answer your questions.
Yeah, absolutely.
Okay.
I'm told that if you go on Amazon and you just put in Sue Green, it goes to my book.
It absolutely does. That's how I found it.
Yeah.
Okay. What is the current state of your health? Are there complications or current issues with your transplant that we have not talked about yet?
No, not really. I told you, I think that my my blood work that tests my liver is a little bit elevated, and I think that's going to be better over time because I went back on the higher dose of the immunosuppressant. I do have MASLD in my current liver, and I don't know that there's anything I could be doing to help with that more than what I do now. I really limit the sugar in my diet, and I'm very careful about what I eat. I exercise as much as I can. Really, the harder thing for me to deal with is the COVID, the long COVID, the fatigue. Again, I just have to be careful. I have to pace myself. I can't do everything that I would like to do. And I just have to be careful, which is hard for me. But it's hard for anybody. But it's been a process of accepting it and just getting on with my life.
Right, right. In my broadcast, Sue, I like to give my guests an opportunity to make a final statement based on their experience, or maybe I missed something. Um, do you have any final statement that you would like to make to our audience before we conclude the broadcast this evening?
You didn't miss anything. You're very thorough, and I appreciate that. The only thing I would like to say is if you do nothing else in your life, look at what you're drinking. If you're drinking soda, diet soda, anything with sugar or artificial sugars in it, stop doing that. That's what is making so many people sick. And a lot of people believe that if people would just get that message, the numbers of people affected by this would go down.
Okay. So it's that uh, sugar, it's that corn syrup, it's the things that you discussed earlier that we have to be careful about.
Yeah, high fructose corn syrup is in the food that you buy in the grocery store, the processed food. But in your drinks, it's mostly sugar or artificial sugar. Really, water is the best thing to drink, although coffee is good for your liver, but not with
Explain
sugar.
that.
Hmm?
Why is coffee good for your liver? They always tell me coffee dries my kidneys up.
Really?
Yeah.
I don't know why, but they did a very large research project many years ago, really, and showed that coffee helped your liver. It might be the caffeine. So I don't know that decaf does the same thing, but a cup of coffee every day without sugar in it is not going to hurt you. But mostly what people need to be drinking is water.
Okay,
That's
that they tell us too.
yeah.
Drink lots of water. Sue, I can't thank you enough for coming on and talking to us. I mean, I learned so much through this broadcast. I'm sure our audience did, and just you're a wonderful teacher, and you explain things so well, and just
Thanks.
haven't had this experience before where we had this kind of discussion, and this was really great. I can't thank you enough for taking time to share your story and educate us.
Well, thank you for letting me be on the show. I appreciate it.
No worries at all. I have a couple of things I need to button up with my audience. So if you wish, you're excused. I've kept you for over an hour and 10 minutes. And
Okay.
I just wanted to let you know that I appreciate very much your coming on and sharing with us. And I'm going to work very hard this next week to get the replay out and give everybody an opportunity to see this that wants to.
Thank you. And I really enjoy your podcasts that you have.
Thank you
And
very much. I appreciate that.
yeah,
All
so
right.
I will leave, but thank you and goodbye.
Bye-bye, Sue. I appreciate. Tell Gene I said hello.
Okay. Bye-bye.
Bye-bye now. All right, everybody. That is our broadcast for this evening. Let me get back on stage here. There I am. And just a wonderful job by Sue. Wow. Just trying to expose everybody to a little bit of new information for us kidney folk. And as you know, there's a little bit of a crossover between kidney disease and liver disease, and yours truly has both. So I thought it was an interesting broadcast. Next week is supposed to be an off week. I don't have anything scheduled. I may come back and talk to you myself. I haven't decided yet. But our next broadcast is January 10th with our friend Mark Reel. He's a kidney patient. He's going to come on and talk about his experiences. And I hope everybody had a Merry Christmas, and I want to wish everyone a happy and healthy New Year. And we will talk to you very soon. Thank you so much for watching.